We're getting the numbers for last year on how much elder care has gone up in this country. And this is according to Genworth. So, Greg, if you decide you want your care at home, I don't want to go into a nursing home, I'm going to be in my own house. The average cost per year for that now is $77,000 a year. If you go into a nursing home, if you share a room with somebody, it's $111,000 a year. If you have a private room, $127,000 a year. And this one, 80% of people over the age of 65 will need some kind of care, elder care, in their latter years. So, Greg, I know that we can talk about this till we're blue in the face, but in my opinion, it doesn't really become real to you unless you have a family member and you understand what this is all about.
I think that's right, Randy. And being that we've dealt with, thousands of retirees going through different elder care loss situations, family members, et cetera, has put us in a very dynamic place that we know this intimately. And I will note that $77,000 for home care isn't full-time. If you want a full-time 24/7 home care person, it is catastrophically more expensive. We're talking hundreds of thousands of dollars a year. Take $25, $30 an hour and then times it by how many hours in a year. It is certainly not cheaper than living in a facility. I couldn't find the number they were using, but $77,000 for home care, and that's unskilled care. I will also note, at home, not that we don't want people to be at home, but a lot of times, they just can't provide the amount of support they need for someone with Alzheimer's or dementia that needs that 24/7 care. A lot of times they have to go into memory care units, which again, Randy, these weren't memory care unit prices that are also more expensive for 24/7 lockdown units. That people need when they have those type of illnesses that are becoming more and more prevalent. So the solutions that we came up with at Ayler Stallings, relate to ways that hopefully fit the market. What we knew is that no one wanted to pay for long-term care insurance anymore. They were insuranced out, right? You get to retirement, and unfortunately, and this is on the industry, they didn't do a very good job underwriting it. So a lot of people early in, let's call it 2005 to 2010, bought a ton of Cadillac policies, which was, hey, I'm going to pay a certain amount, and then I get unlimited amount to pay for my long-term care. That's what we call Genworth used to have those policies. MetLife had those policies. And if you look at the history of long-term care insurance, that was like the gold standard where you just paid for it, and they're just like, yeah, we'll pay for whatever it is. Well, what they didn't realize that in the 1980s, skilled care, nursing home care was like $10,000 a year. And now in 2025, it's $10,000 a month. And the reality was Alzheimer's and dementia completely broke their model, right? Like you had people that usually were staying 2 years, 1 year. Now you have people staying 10 years, 12 years, 15 years. And the model just wasn't, and it basically ran a lot of insurance companies out of business. They still have providers that underwrite it, but it's a lot more expensive. That's really the short answer. It's a lot more expensive to get long-term care now. And most people don't have the appetite to be like, well, I only get 3 years. Or only get 4 years, 5 years. What if it's 10 years? Well, it doesn't cover it. And then yet they're still paying these big premiums. And they've also had some bad PR where the insurance companies have raised their premiums. You go into a nursing home and everyone thinks, let's say the typical, someone breaks a hip, someone breaks a knee, they go in, they go to rehab, they go to a facility for rehab. All of a sudden they see, well, mom has this traumatizing event triggers and exacerbates a mental issue, Alzheimer's, dementia. Like, hey, mom and dad have, early onset or advanced, memory issues. They can't go home. So now the family's like, all right, well, they think Medicare is going to pay because Medicare's paid for their healthcare stuff their whole life in retirement. Medicare pays for not to exceed 100 days, up to and not to exceed 100 days. A lot of people, they don't get more than 30 or 40 days. And, at the point of time in which Medicare kicks off, and Medicare kicks off when you stop getting signs of improvement. So a doctor says, hey, they're not getting any better. You're kicked off Medicare. So now all of a sudden you get your first bill for $8,000. And you're like, what just happened? No, Medicare pays. Well, no, Medicare doesn't pay for nursing homes. It doesn't pay. I'll say again, Medicare does not pay for nursing homes after up to the first 100 days. So then you pivot to, well, what happens now? Well, you get your checkbook out is what happens. Because you start paying and nothing kicks in till you basically run out of money. The surviving spouse, I think, can keep the house. They can live in the house. They'll put a lien on it as you live there. So they won't kick you out of the house, but they'll bleed you down to, let's say, every state's a little different. And it depends on how they, for Medicaid for the aged is what you're trying to get. Not Medicaid for the indigent. Medicaid for the aged is the program in most states that's run by the Job and Family Services. And what ends up happening there is it's like $120,000, give or take. So like you get a little bit over $100,000 is what the surviving spouse can keep, and then the spouse in the facility starts getting Medicaid benefits. And when Medicaid benefits turn on is when they start keeping track of those Medicaid benefits, and then they put that lien against the house. Now, if mom or dad, whoever's at home, goes to sell the house, they will realize that lien. If they don't, until mom or dad dies, then with the kids, they'll have to pay off. A lot of times there's no equity left in the house because the Medicaid lien will eat up all the value in the house. So these are the things that I think most people don't realize how catastrophic it could be, because at $150,000 a year, it doesn't take long to eat up a life savings at all. We came up with asset protection trusts. We didn't invent them, but we use them. And I think they're a very effective tool and alternative to long-term care insurance. They're a lot more, they're much more economical in almost all cases than sitting there trying to pay premiums for the rest of your life. And then if you end up, forfeiting the policy, you don't get anything out of it. Whereas an asset protection trust, you put things into this trust, your home, maybe other investments, and in 5 years, everything in that trust is 100% protected from the nursing home, which is and increases eligibility for other government programs, the VA benefits, Medicaid, et cetera, et cetera. So this is a great option, I think, for people that are concerned with long-term care. I think anybody that has less than, let's say, $2.5 million of investable should be thinking about long-term care strategies. It's part of every roadmap we build, Randy. I think it's super important. I think it's vital to be a complete retirement plan. If you don't talk about long-term care, you don't have a retirement plan. Now, your options could be different and you could choose to do different things, but you have to at least have the tough conversation. No one wants to go in the nursing home, but no one wants their house to burn down either, Randy, but we all have homeowners insurance. And I think that's what this is. This is your version of homeowners insurance where you're thinking, if this happens, I don't want my spouse to be impoverished. I don't want them to get everything. What can we do to protect some assets so that they're available to me or my spouse in these catastrophic situations? And I think this is an option that a lot of people are using.
We would love to have the opportunity to talk to you about your retirement on all the different levels, not just investments and markets and taxes. Yeah, that's a part of every roadmap for retirement. But we also want to talk about some of these hard issues as well, because they can really affect you financially. Give us a look on our website. Give us a call. GetYourRoadmap.com is our website. GetYourRoadmap.com.